Welcome to This Explainer. Today, we're decoding something you carry with you literally every single second of your life, yet you probably don't fully understand it. We're talking about the human pulse, the ultimate rhythmic baseline of your body. Let's dive right in.
So here's our roadmap for today. We're going to define what a pulse actually is, break down its 6 core characteristics, map out how pulse rates change as we age, and wrap up with a really cool memory trick to remember those rates instantly.
All right, section 1, what is a pulse? Let's define the rhythm. Now, the absolutely crucial thing to understand here is that a pulse is not just some echo of your heartbeat. It's the literal physical expansion and recoil of an artery. Think of your artery like a super elastic garden hose. Every time the left ventricle of your heart powerfully contracts to pump that oxygen-rich blood out to the rest of your body, it sends a pressurized wave of blood surging right through that hose. So what you're actually feeling when you check a pulse, it's the artery walls stretching outward to fit that wave and then immediately snapping back. It's totally mechanical, it's dynamic, and it's driven directly by that left ventricular contraction.
Moving on to section 2, the 6 characteristics of pulse for a comprehensive assessment.
When medical professionals feel a pulse, they aren't just counting beats, right? They're doing a full assessment using 6 defining characteristics. First step is the rate. That's simply the number of pulsations in a minute. Second is rhythm. Is it steady or is it kind of skipping around? Third is volume, the actual amount of blood pushing through. Is it a strong surge or more of a weak trickle? Then we look at tension, which is the literal stretch in the artery wall. Number 5 is compressibility, like how much physical pressure do you actually need to apply to completely stop that blood flow? And finally, equality, checking to see if the pulse is symmetrical on both sides of the body.
But, hey, there is a massive exception to that final rule of equality. Normally, you assess symmetrically, checking both wrists at the same time to make sure the blood flow matches. But you absolutely never ever do this for the carotid artery in your neck or the apical pulse at your heart. Why? Well, if you compress both carotid arteries at the same time, you risk cutting off blood flow to the brain entirely. Not good. And the apical pulse, well, that's taken directly over the heart itself, so there's literally no symmetrical pair to check anyway. It's a vital safety exception you have to remember.
Section 3, pulse rates by age and how they change as we mature. Let's look at the exact normal ranges and averages across different stages of life. A newborn, so that's 0 to 28 days old, has a super rapid average pulse of about 140 beats per minute. By the time that infant becomes a toddler, the average drops down to 100. Fast forward a bit, and an adolescent or adult settles into a normal average of roughly 80 beats per minute. So there's this very clear descending pattern as the human body matures.
You might be wondering, why exactly does this downward trend happen? Well, think about it. A newborn's heart is tiny, right? It needs to pump incredibly fast just to circulate blood through a rapidly growing body. But as the heart muscle gets larger and stronger throughout childhood and into adulthood, it becomes way more efficient. It pumps a much greater volume of blood with every single stroke, which means it simply doesn't have to beat nearly as fast to get the exact same job done.
Which brings us to our final section, number 4, the memory trick to easily memorize all those averages.
Look, trying to memorize all those different ranges can feel completely overwhelming. But don't worry, we're going to unlock a really effective cheat code right now so you never need to look at a chart again. To use this trick, you only need to commit one single number to memory. 140. That's 140 beats per minute, which, as we just learned, is the average pulse for a newborn. Just lock that one number into your brain.
Got it? Okay. From that starting point of 140, you just apply a really simple rule of subtraction. Ready? It's minus 20, minus 20, minus 10, minus 10. Let's do it together. Start at the newborn average of 140, subtract 20, and bam, you get 120 for an infant. Subtract another 20, you're at 100 for a toddler. Now we switch to tens. Subtract 10, you get 90 for a preschooler. Subtract one final 10, and you arrive perfectly at 80, the average for an adult. It is such an elegant, foolproof way to calculate the average pulse for every single age group. Literally all you need is 140 and the sequence 20, 20, 10, 10.
We've covered a ton of ground today, right? From the literal mechanical expansion of the artery walls to the 6 clinical characteristics to the really fascinating way our heart rates just naturally slow down as we grow up. But it leaves us with this final, kind of wild thought about our own cardiovascular health. Knowing your baseline inherently changes over a lifetime, and knowing your heart rate is constantly adapting to keep you alive, what hidden variables in your daily routine, like your stress levels, your hydration, that extra cup of coffee, are influencing your vital signs right now without you even noticing? Next time you feel your pulse, remember the mechanics behind that rhythmic throb. Thanks for joining me on this explainer, and keep staying curious about the incredible machine that is the human body.